Nerves and muscles are common, but not many people may be aware there are neurology specialists who can help. Now, these conditions can also affect the Black and African American communities disproportionately, and Hartford Healthcare is addressing these disparities. Here today to talk about this important initiative is neuromuscular specialist Dr. Barry Gordon, the Regional Medical Director at Hartford Healthcare's Ire Neuroscience Institute. Doctor, welcome.
Thanks for having me.
Great to have you. So Hartford Healthcare's Ire Neuroscience Institute, I hope I said that right, has been running the Healthy Brain series for Black and African Americans. Can you tell us what neurological condition you will be speaking about next?
So my talk this Thursday is going to be about neuropathy. It's entitled Tingling Toes, Poor Balance. Perhaps it's neuropathy. And neuropathy is a condition that affects typically the longest nerves of the body, and that's the nerves that go all the way down to your toes. And sometimes that can start just simply as being tingling or painful toes, or it can affect your balance. So it's important to know about, it's important to look for.
All right, doctor, how does neuropathy affect the Black and African American communities disproportionately?
Well, we know that one of the most common causes of neuropathy is diabetes. And there is an increased incidence in diabetes in the Black and African American populations. And so it follows that with a higher incidence of diabetes comes a higher incidence of neuropathy.
All right, doctor, tell us about treatments for neuropathy.
Well, the treatments for neuropathy are really a couple. One is to treat the symptoms of neuropathy. So sometimes neuropathy can be painful, and we have different treatments for the pain related to neuropathy, aside from what would be a typical painkiller. The other treatment for neuropathy is to protect against balance, protect against falls, because people lose their balance and they can fall and, of course, fracture a hip or worse. So we want to protect them against falls and subsequent injury. And then the other important point is to try to see what's causing the neuropathy. If we can treat the cause of the neuropathy, say we discover someone is deficient in a B12 vitamin, we can supplement that and we can limit the further nerve damage.
All right, doctor, your series of events, we have about 10 seconds left. Is this Thursday? How can people find you?
They can find us by coming to the First Church in Bloomfield. We're going to have an informational lecture. We'll have some question and answer. And then the other thing that's going to be unique about that night is that at that presentation, we will offer every single person in attendance a screening exam for neuropathy right there and then that evening.
All right, Dr. Barry Gordon, thank you so much. And we'll have more on our website, WTNH.com, if people want to get more information on that. Have a great event.
Thanks very much.